Today we're going to talk about child abuse and child maltreatment. We're going to identify the different types of abuse and maltreatment and learn how to report it. It's important for us in the pre-hospital setting to know when we should suspect child abuse or maltreatment and how to report it. It's our duty to report. Abuse is one of the leading causes of death in infants under 12 months of age. In the state of Florida, 5 children die every day at the hands of an abuser, and more than 50,000 children are victims of child abuse every year. The highest incidence of child abuse happens from birth to 1 year of age. Children that are younger are at higher risk for fatal abuse and neglect than older children. 71.8% of children who die from abuse are under the age of 3, and 49% are under the age of 1. There are many types of child maltreatment: physical abuse, sexual abuse, emotional abuse, neglect, and multiple combinations of these. Physical abuse is defined as the intentional physical injury inflicted on a child younger than 18 years of age or a mentally disabled child younger than 21 years of age. This is usually done by a parent or caregiver and can cause permanent disfigurement, distress, or even risk death. Emotional abuse consists of a pattern or behavior that interferes with normal psychological or social development of a child. This happens when a child is made to feel worthless, unloved, or alone, or scared. It is also known as verbal abuse, and it is a common form of child abuse that includes hostility, bullying, yelling, criticism, and exposure to a lot of family violence. Sexual abuse is a form of child abuse in which an adult or older adolescent uses a child for sexual stimulation. This includes engaging in sexual activities with children, indecent exposure, child grooming, and sexual exploitations, including using a child to produce pornography. In most cases of sexual abuse, the perpetrator is an adult who knows the child and is often living under the same roof. It is a huge misconception that child abuse is often perpetrated by strangers. According to the American Psychology Association, an estimated 60% of child abuse perpetrators and sexual abuse are known by the child but not by the family. 30% of cases are family members and only 10% are strangers. Sexual abuse usually does not occur in one single incident. It's usually a series of events or continuous abuse, and it does not always involve violence or physical force. Commonly, it leaves no visible sign, so it's very hard to detect. Children are often manipulated to thinking the behavior is normal or kept silent or secret by threats. So this is something hard to identify. Child neglect occurs when a child is endangered physically, mentally, or emotionally due to a parent or caregiver's inability to provide basic needs. Neglect may involve a caregiver abusing drugs or alcohol and abandoning their child. Child neglect is the failure to act on the behalf of the child and usually is an act of omission. There may be visible signs of neglect that usually occur over a period of time rather than one episode. Neglect can be physical, emotional, or both. Failure to supervise a child, provide housing, clothing, medical attention, nutrition, social needs, any of those are considered child neglect. There are some groups that are at higher risk to be abused than others. As we discussed earlier, children under the age of 3 have a higher incidence of child abuse. In addition to this, children with special needs, nonverbal children, toddlers who are not speaking yet, and those with increased medical responsibilities are at greater risk for abuse or maltreatment. There's no specific profile for an abuser. Abuse affects all races, all ethnicities, all religions, and all social statuses. There are some factors such as family structure, substance abuse inside the home, single parent homes, and domestic violence within the home that might make the home higher risk for an abuse situation. In these situations, have a higher index of suspicion. It's important as a responder that you understand that you always need to report abuse if there's any circumstance that suggests it, regardless of the family's socioeconomic status. Often, abuse is underreported in homes with 2 parents and higher levels of income. If you suspect abuse, make sure you document well and report what you've seen. First, we'll talk about the caregiver. You may notice some signs or characteristics among caregivers that are common in homes where children are being abused. Often, you will find drug abuse, poor self-concept, immaturity, lack of parenting knowledge, and lack of interpersonal skills in these caregivers. Consider these things a red flag and notice these behaviors. They don't necessarily mean that the parent is abusing or mistreating the child. It's just a warning sign. So if you're on a call and you find these things and you identify them, you should have an open index of suspicion and fully assess the child for any signs of abuse. If the scene is safe and you have access to the child, your first priority should be providing immediate medical care to the child. Consider every call for pediatric trauma and pediatric cardiac arrest under 1 year of age a suspicious circumstance. If the child has an altered mental status or abnormal responses to verbal or painful stimulation, assess the patient for a traumatic brain injury. We'll come back to a conversation about abusive head injury shortly. If you find that your patient is stable and the scene is safe, take your time, gather a history. Sometimes that history may be even more important than the physical assessment. If your patient is stable, make sure you ask questions that are non-judgmental to the caregiver and document the caregiver's response very carefully. Sometimes you can even use quotation marks to document exactly what they said. This might make a difference in the investigation later on. When you're performing a physical assessment and you're investigating for signs of abuse, look for things such as hand marks, hand-shaped bruises, pinch marks, puncture wounds, belt buckle-shaped injuries, rope burns, physical bruises that are in different stages of healing, burns, fractures, and signs of malnutrition. If you find physical signs of abuse, make sure that you document them, including description of the injury, size, color, location, shape, and draw them on the diagram in your EPCR. There are a few things that mimic abuse that you might find on your physical assessment. Things such as cupping, Mongolian spots, impetigo, erythema metamorphomae. We'll show you a few pictures of these here. We're going to go back for a moment and talk about abusive head trauma. We used to call abusive head trauma shaken baby syndrome. It can lead to seizures and apnea. It involves diffuse intracranial hemorrhage from violent shaking of an infant or baby without impact of another object. When you receive a call like this, the person that is caring for the child at the time of the EMS call should not immediately be assumed to be the perpetrator of this abuse. Signs and symptoms of abusive head trauma are lethargy, irritability, vomiting, seizures, or apnea, or even cardiac arrest. On your assessment, you might see things such as petechiae and hand gripping patterns on the arms or chest of the infant. If these signs of trauma are present, after your primary assessment, you should begin transport immediately. If the scene is unsafe, call for law enforcement or backup and move to the ambulance as soon as possible. According to the Florida Statute 39.201, any person who knows or has a reasonable cause to suspect that a child is a victim of childhood sexual abuse or a victim of a known or suspected juvenile sexual offender shall report knowledge or suspicion. In any cases of abuse, fully document the situation and observations in the patient care report. Notify the Florida Department of Children and Families at reportabuse.dcf.state.fl.us and notify the appropriate law enforcement agency. Also, ensure that you notify the hospital and or any other receiving facility.